That's what my doctor specializes in. So if she might have some questions, I don't know if you can call and see if she might have some questions. You can ask for her. Well, we got 20 on the call. We're gonna go ahead and get started. Good to see everybody. I'm excited tonight because because as you know, our theme for the year is ministering to the total person, spirit, mind, and body. And so we've been blessed. We've been blessed this year already, but we're going to be blessed again tonight. My good friend, my frat brother, one of the greatest chiropractic minds in the country. He's like, you can't see your picture. I got your picture up right now.
Yeah, I see it.
Oh, okay, you got it working. Yeah, man. I don't know how long we've been friends now. He blessed me when I was going through all that issues with my hips and all of that, and kept me going for 3 years.
Yeah.
Them bad hips until I just finally couldn't take it no more. But he's amazing. He is the Dr. Arthur Matthews III, Rainbow Chiropractic and Personal Injury Centers. So we are delighted to have him on the call tonight. People are still coming in, but we got 25 in. We're gonna go right ahead and turn it over to Dr. Matthews. Doc, welcome, and thank you so much, family. You can generate some questions. You can put them in the chat, or you can write them down.
Yeah.
Any questions?
Yeah.
We're gonna allow some time at the end for question and answer. All right,
absolutely,
man. Thank you for coming.
No, thank you for inviting me. I know that we've talked about this for quite some time, and now that it has come to fruition, I'm very excited about this. And this is one of many, but I know I had to get to you. And so, Happy New Year, Friendship Baptist Church.
Happy New Year.
If you are here, you made it through 2020.
Amen.
And we have to acknowledge that pandemic. We have to acknowledge that exciting election that we had, leaking right into 2021. And in 2020, I did have some ups and downs. I lost my parents in 2020, my mother on April 5th to Alzheimer's, and then my father did succumb to COVID-19 July 23rd. So it was very, very devastating. However, I through my mother's teachings, my father's instruction, they had prepared me, little to my knowledge, or little known to me, to carry on without them. And of course, they're spiritually based, and my mother and father love God as I do. And during a fast, trying to get over and trying to get some clarification, I ran into Luke 9:57 through 62. And basically, these were followers of Jesus, and I'll go into that very briefly because it is part of my testimony, and I feel like everybody, worthy should know that there is help out there spiritually when you feel like there is nothing else or nobody that can help you. That fast, I can testify that fasting does work.
Hallelujah.
Because this passage, Luke 9:57 through 62, came to me, followers of Jesus. And 57 reads, on the road, someone asked, and this is the Message version, because I did go through a number of versions, but the Message version was the one that hit home. And on the road, someone asked if he could go along. I'll go with you wherever, he said to Jesus. And Jesus was curt and said, are you ready to rough it? We are not staying in the best inns, And then Jesus said to another, follow me. Okay, and this is 59. He said, certainly, but first, excuse me for a couple of days, please. I have to make arrangements for my father's funeral. And so immediately when I read 59, I knew that this was for me. And then 60, Jesus refused. First things first, your business is life, not death. And life is urgent. Announce God's kingdom. Amen. And then 61, another said, I'm ready to follow you, master, but first, excuse me while I get things straightened out at home. And Jesus said, no procrastination, no backward looks. You can't put God's kingdom off until tomorrow sees the day. And that hit home with me, and it allowed me to move forward very quickly. And of course, I still have those isolated times remembering my parents, but rest assured, I have moved on in a very strong manner. And that brings me to this moment right here. This is the opportunity that I've wanted and needed. And I thank the good Reverend Doctor again for allowing me to come on. Again, my name is Dr. Arthur Matthews, and I've been practicing chiropractic since 2001 when I graduated. I am the owner and operator of RC Chiropractic and PI Centers. I have 2 locations. My Alpha Clinic is in Duluth, Georgia. My Beta Clinic is in Buckhead. My number is 844-722-4470. That's 844-722-4470. And my website is www.rcchiropicenters, rcchiropicenters.com. And I'll repeat that at the end. I have specialties within chiropractic, and I'll get into what chiropractic is in a few moments here. But my specialties within chiropractic, the number one is the CHAOS, the Corporate America Office Syndrome. That is a syndrome for people who work on computers for prolonged periods of time, on average 5 to 7 hours. There are just classical signs and symptoms when you are working on a regular basis on a computer and you do not have the correct setup or the correct desk or working station. Your working lifestyle is equivalent to a couch potatoes lifestyle. You have a very work sedentary lifestyle, and some of the issues that a couch potato has, some of those same conditions, a sedentary work lifestyle will also present. And so I noticed that, and so I have a set protocol that gets about 60% of great results as far as relief of pain, and then of course keeping off the pain and putting you in a very good state for a very long period of time. So I'm very proud of that. And then number 2, my specialty is foot orthotics. Basically, your feet are just as important as your spine is. And I know that most chiropractors, you're accustomed to associating chiropractors with the spine, and that is true. The brain, the spinal cord, and the hips, and most chiropractors stop there. However, again, my specialty is foot orthotics. I do a thorough foot exam. I make sure that I measure your angle of your feet as they are hitting the earth, so that they are free and clear and landing very balanced. I adjust the feet just like I adjust the spine. I customize orthotics in the office so that now you're walking out in a stabilized condition from the bottom up and also from the top down. And I found that I get great results with that. So if you're interested in total health when it comes to chiropractic, I advise you to find someone who does orthotics along with adjusting the spine. My number 3 specialty is called the MUA, manipulation under anesthesia. Okay. A lot of times in my office, I deal with a lot of personal injury. That's car accidents and slips and falls. And so I'm certified to manipulate the spine or adjust the spine or crack the spine, so to speak, crack meaning not break, under anesthesia. Therefore, we're avoiding injections. Therefore, we are avoiding surgeries. And that is a viable option before any sort of injection, a viable option before any sort of surgery. Okay. And so I offer that in my office. It is covered by major medical, except for Blue Cross Blue Shield. And in a personal injury, of course, if it's not your fault, the third party pays that. And of course, we accept all forms of payment for that. And number 4, it's just general chiropractic, your low back pain, your neck pain, your headaches, numbness and tingling, vertigo, all sorts of issues that the chiropractor can address. All right. And so with that, I need to explain what is chiropractic. All right. Now, chiro means hands. Practic means to practice. So I practice with my hands. And now I do use some instruments that I have that will help accentuate the visit and whatnot. That helps me get relief for soft tissues and whatnot. But 95% of the time, I'm putting my hands on your spine to move those bones very gently so that I can get the results that you're looking for. And when I explain chiropractic, and this is a spine right here, when I explain chiropractic, I like to use what we call a power plant scenario. Now, I'm here in Atlanta, and I know that I get an electric bill every month from Georgia Power, but Georgia Power has a main plant somewhere. It's producing lots of energy and electricity, and they're sending that out over power lines. The same power lines you see when you're walking down the street in your neighborhood, they send that energy out over power lines. Now, those power lines are held in place by those utility poles or telephone poles that you see. And so if we were in your house and a car would have hit the utility pole outside of your home, the side effects would not be felt on the street. They'd be felt where? Inside your house. What does that mean? Your TV doesn't work, your refrigerator doesn't work, all because of the accident that happened on the street. In the body, it's the same concept. Now, here is the spine right here. Here is the back of the head right here. So we're lying with our face down. So if this is the back of the head here, in here is the brain, the Georgia Power, producing the energy and electricity, sending it out over power lines, these nerves here, these little yellow structures that you see, okay? Those are the power lines, all right? Those power lines are held in place by these bones of the spine, the utility poles or telephone poles. Those are the bones of the spine that hold these nerves in place. When these bones get out of alignment, they will sit on these nerves. And when they sit on these nerves, out here in the soft tissue in the muscles is where you have your side effects: pain, tenderness, numbness, tingling, headaches, all of that. And so people say, well, doc, how do I get like that? A number of ways: slips and falls, car accidents, working on a computer, raising kids, teaching kids. There's all sorts of ways that we wreak havoc on the spine. So as a chiropractor, what I do is I come in and I very gently move these bones back where they need to be. It takes the pressure off of the nerves. So therefore, again, out here in the soft tissue and the muscles, everything begins to subside. And we do things in the chiropractic office. A lot of you base everything off of pain. Pain is not always a good indicator of your health. You can have a heart attack, and heart attacks are very painful, but can be very sudden, and you can die from that. So pain is not always a viable option to say, hey, I am healthy. You need to be checked out thoroughly by all of your doctors. And chiropractic is just one bullet in your healthcare gun that you need to have. And so with that, everything comes full circle when you involve everyone in chiropractic and learn to be diverse, okay? And so that was basically what chiropractic is. And now with that power plant scenario, so there are concerns here that I want to touch on, and there's three major ones, and I'll tie the first two together. And that is, and these plague the Black community, and these plague Black men for the most part. 90 to 95% of my practice is women. They are very aware of their health. They are not afraid of doctors. And if there's anything wrong, they are off to the doctor in a second. However, women of the household normally make 60 to 70% of the medical decisions in the house. And so that means that us men, we are hard-headed and we do not like to go see the doctor. So I'd rather focus on that right now. And then maybe if you'll have me back, I'll focus on more female issues. However, us Black men, we suffer from three major issues that I see that come into the office. And the first one is high blood pressure and erectile dysfunction. Okay. Now, those two, they go together. Chiropractic can help erectile dysfunction. Chiropractic can help high blood pressure. Okay. Now, high blood pressure for the Black community comes more so from bad diet, nutrition, just bad general health habits. A lot of these health issues that you have today can be alleviated by just improving on our diets, drinking more water, having a balanced diet, staying away from the high cholesterol, high saturated fat diets. A lot of these issues, health issues that we're having in our community can be thwarted if we take the time and make diet and nutrition a lifestyle. And that also includes exercise. The body needs it, the body wants it, and you should give the body what it needs. All right. And so with that high blood pressure, that means that the body has to work harder. The heart has to work harder to pump the blood through arteries for various reasons. And it's usually due to clogged arteries and whatnot, making the heart work harder. What I call, the big stomachs that we see, that is cardiac fat. And the heart has to pump blood through that also. And it puts stress on all systems of the body when you have high blood pressure. And that includes the reproductive organs, also known as the genitals. And so erectile dysfunction is a lack of blood flow to the genital area. Starting from age 40, over 35 to 40% of Black men will experience that. Now, you couple that, let me see, let me get it right. Okay, so a Chicago area study of 50 individuals, all right, and this is about high blood pressure. Area study of 50 individuals with a misaligned atlas. An atlas is the very first bone in your spine. Okay, there's the skull, and then the skull sits on the atlas, and that's the very first bone in the spine. There was a study with a misaligned atlas, the very first bone in your spine, and they correlated that with high blood pressure. It showed that after a chiropractic adjustment to that bone, that the high blood pressure went down significantly, and that decrease was equal to taking 2 high blood pressure medicines. Okay, and so we know that high blood pressure can be affected through a chiropractic adjustment. So if you're dealing with that, that is one good reason, great reason to get to the chiropractor. And these lights in here, they got me hot, so I'm sorry. And so that is a good reason to get to the chiropractor, is for high blood pressure. I have a number of patients who come see me, and all I do is I operate. When I say operate, I function up in C1 and C2, those first 2 vertebrae, and we are seeing tremendous results, and we are weaning people off of high blood pressure medicine in conjunction with their diet, in conjunction with a regular routine of exercise. This is not a one-stop shop where you come here and everything is cured. The only thing I can cure is a ham. And so we need your help when it comes to your health, okay? Don't leave it up to the practitioner to take you out of your situation. You do have to be fully involved. And so with that, the high blood pressure affects the reproductive system. So you can see, if we take care of the high blood pressure, how that can affect the whole body in itself, and more importantly, erectile dysfunction, because that can actually ruin relationships. It can ruin egos, and it can really ruin an individual's life if no one can perform on a regular basis like everyone should and wants to. And so those are the first 2 that I'm very concerned about in the Black community, is the high blood pressure and the erectile dysfunction, because they go hand in hand. One feeds off of the other, and it's actually very, very easy to turn things around if you just dedicate some time to your health. Now, that third issue that I want to talk to you about is prostate cancer. Black men and prostate, the numbers are staggering. And here we go again with not being screened in time, waiting until things go awry. We can't function anymore, or something's just gone wrong, and then we find out, that we have some advanced cancer here. And simply, there's 4 things that we should know that Black men need to know. And one is, Black men both get and die from prostate cancer at a higher rate, and the reasons are complex and unclear. And then you also know, if you've been around this world for a little while, that there's racial bias in the medical field when it comes to African Americans. And so we have to be even more diligent, more intelligent, more attentive to when we go see doctors, and make these doctors do the right thing, including myself. Black men are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease. Prostate cancer in Black men tends to have biological characteristics. This is in our genetics. We cannot avoid that. Okay, that does not mean we accept that and say, well, it's in the genetics, so I guess I must accept it and deal with it, because I'm gonna get it anyway. We do not do that. That is a defeated mentality, and it will defeat you every time in the long run when we think like that. The higher risk tied to the higher risk for Black men is tied to also the environment and our behavior. And this goes back to social stress. We understand what that is in this society when it comes to the Black man. We're more exposed to cancer polluting, to cancer causing pollutants in our neighborhoods. They're used as dumping zones for chemicals, for toxic garbage and things like that. We have the high wires over our neighborhoods and whatnot. There are all sorts of cancer causing agents that are out there that they put in designated areas that are usually where minorities like ourselves live. Okay. And so with that, number two, Black men should be screened for prostate cancer more proactively. We've got to get the digital exam. We've got to get the PSA test. That is the most accurate way of detecting and dealing with prostate cancer. It has to be detected early, and the earlier that is detected in a Black male, the better. And one of the things that they want to do that we should be very cautious about, and this is my if you don't listen to anything, listen to this. Black men and their doctors should be more cautious about active surveillance. Active surveillance is an approach in which low-risk prostate cancer is not treated with surgery or radiation therapy. Instead, it's monitored very closely for any signs of change over months and years. That is the better alternative than the side effects of surgery or the side effects of radiation. There's really no coming back from that. And to be honest with you, you don't really die of prostate cancer. You die of metastasis of prostate cancer, which usually one of the major places, and I've caught this, it metastasizes to the lower back. So I have men who come in with lower back pain. I go through all of the protocol and then come to find out they haven't had their prostate evaluated. We send them off to get evaluated, and then there's a situation. It has metastasized to the lower back. And so that is a red flag sometimes when you fall into that age group of having prostate cancer, especially being Black/African American. And so the active surveillance is a good way of doing that. However, because the rate is so high in the Black community amongst Black men, active surveillance sometimes is not necessarily the smart thing to do, and the regular testing is. And so, with that and wrapping up, basically, we've got to take control. Okay, chiropractic is one of the very first avenues where you can start to do that. Okay, I have access to all sorts of other doctors, and if I see red flags that are out of my scope of practice, I always refer to the proper authority, and I always follow up with that authority to make sure that they are treating you correctly, especially coming from my office. I just have a pet peeve about that in the medical community. And so with that, we want to now open things up for some questions. Reverend Dunston, I know you had 5 of them. If you want to go ahead and start with yours, I'll go ahead and start answering your questions.
Okay, I'll go with one, Doc, and thank you so much, my man. That was a lot of information you shared in a very short time. So family, begin to think about questions that you want to ask Doc while we got him here. We're just grateful that he took the time out to be with us. This kind of all started many years ago when it was actually doing a sermon. It was in service, and I asked the ministry, how many of y'all have ever had an adjustment? And I was floored. I was shocked. I think maybe one person in the whole congregation raised their hand. and it was bewildering to me. It was, and I don't know why it shocked me so, but that's kind of was the impetus. So Doc, I want you to just what is an adjustment and why is it important that we have these done? If you can start with that one.
Gotcha. An adjustment is a low force, hold on here, is low force tension applied at angles through my hands and knowledge that they teach me in school to, in layman's terms, move the bones, okay? And when I move the bones, we get an audible, which is what society knows as cracking of the bones, okay? Let me say this, we're not cracking or breaking anything. That crack that you will hear, that is just nitrogen gas releasing from the capsule, okay? It's harmless, and what that allows us to do when you hear that crack, it opens up that joint, and that joint is allowed to come back in its proper angle, and that is what an adjustment is.
How often should an individual have adjustments?
Okay, so very good question. If you have a spine, you should be seeing a chiropractor once a month, and that's just plain and simple. Once a month. Why is that? It's the same kind of attentiveness that you would do for your car. When I say for your vehicle, that means you get your oil changed at a minimum, because you know that changing the oil is the most basic thing and one of the most important things that you can do to maintain the integrity of your car. And so we do that on a regular basis. I make the statement in the office all the time. People take better care of their cars than they do themselves. And so we are the body mechanics. Chiropractors are the body mechanics. We are the one that's going to see you more so on a regular basis than the MD, which will see you on a crisis situation. Okay. Now, that once a week, that once every 3 weeks allows me to maintain the balance of your body. It allows me to address issues that are coming up during the course of your life, moving around at your job, at home, just going through life. You need a body mechanic, and a body mechanic is the chiropractor that will treat your spine and everything else. We move everything from the rooter to the tutor. So whatever you coming in for, more than likely we can help with that. Okay.
And Doc, what's the result? You go for years and years, like most of us as Black Americans, and never even have an adjustment. I mean, what's the residual effect of never?
Well, as everybody knows, moving parts, they wear down. They get out of alignment. Why do you get your car aligned when it's pulling off to the left? You don't go get a whole new set of tires. You take it in. And you let somebody align that. And when you don't do that, that will throw everything off, make everything worse. When you don't get that oil change on a regular basis, will your car fall apart right then? Excuse me, no, it will not. But it will accelerate that deterioration process because you are not taking care of it properly. And if you are not doing the most basic, if you are not changing the oil in your car, you know for a fact that car has got a limited life. If you are not changing the oil in your body, if you are not seeing a body mechanic, then you are taking a risk with all of these factors that life puts on your head, and then that one time you reach in the pantry to grab them peas and you can't and your back goes out and you wonder why. It's because you haven't had a body mechanic look at your spine, look at your body on a regular basis and stop things before they start, or if they start, we stop them right there in the beginning.
Great, Doc. Candace has her hand raised. Candace?
Yes, I wanted to know, I've had adjustments before and they're awesome. I love them. But what does it actually do for scoliosis?
Okay. Scoliosis. Now, you have to be diagnosed officially with scoliosis. Now, there are anything less than 18 degrees is considered a normal lateral curvature of the spine. And so what we would do, it depends on your age. So if you're pre-pubescent, there are definitely things that we can do to stop that scoliosis from progressing. Now, if you are post-pubescent, then you have what we call a functional scoliosis or a functional lateral abnormal lateral curvature of the spine. Pretty much things are etched in stone. Now, what as chiropractors we do is we adjust above the curvature, below the curvature. And then for me, what I do is I have an instrument that goes right into the curvature to help try to align it back to normal as possible. Okay, again, when you are over 18 and basically puberty has stopped, pretty much everything is etched in stone at that point. And if you have a lateral curvature of the spine or you have a scoliosis, you definitely need to see the chiropractor on a regular basis. But chiropractic can help scoliosis by addressing above the curve and below the curve, and then using a special apparatus. And some chiropractors use other items also to address the curve directly.
Thank you so much.
Yes, ma'am.
Excellent question. All right, just raise your hand or jump in with your question.
Doc, you mentioned something about sciatica.
Yeah, sciatica is becoming a major issue in our community. Can you speak to why that is, and what can we do early on to maybe prevent that from?
Yeah. Just real plain and simple, to be upfront with it. There's been an uptick in sciatica because America is overweight. We have an obese nation, and that needs to be addressed. And Michelle Obama tried to address that because it does affect the younger generations also. When you are overweight, when you are not exercising, when you have a sedentary lifestyle, and all of that weight is sitting on that spine, it can wreak havoc in the lower part of the spine, in the lower back, because that is where most of the weight bearing is sent, is through the low back, through the hips, out the legs, through the feet, into the universe. And if you are excessively overweight, if you are obese and whatnot, that contributes 30 to 40% to low back pain, which then can contribute to sciatica and really begin sciatica. Now, sciatica can be brought on by traumatic events, a car accident, or slip or fall. But for the most part, it is due to a sedentary lifestyle. And usually people who suffer from sciatica are somewhat overweight or have a weight issue that we need to address also. Chiropractic adjustments through flexion and distraction, meaning we stretch the spine. We get in here and we stretch the spine like that in a longitudinal axis. And what that does is it opens up those nerves, those places where those nerves are, and allows those nerves to get back in there where they need to be, and they're at the right angle. And so that is how we treat sciatica, along with a lot of soft tissue modalities like TENS units, heat, ice, stretching, and other things.
Excellent. Questions?
I have a question. So is there different preventative maintenance type things you can do at home? I know they sell a lot of different gadgets and gizmos. I personally have bought or purchased the Chirp.
Okay.
I'm familiar with that one. I with some frequency, I have been using that on and off, and I just want to know your take on that. And is that good? Is that better than nothing, or what's your take?
Well, okay, I got a little confused there. Sean, say that question one more time.
Yeah, no, I was just wondering about like different things you buy at home to do like self-adjustments. Like this particular one, you literally roll your spine over it while you're, here at home in the floor. And I was just wanting to know, like, what's your thought or recommendation or comment?
Yes.
Also if there's anything you can do at home
right,
for maintenance.
Right. So one of the things I tell my patients, don't go out here, start buying all this stuff up and whatnot. What works for the next person doesn't work for you. I start with the free stuff. We got YouTube. So, if you're having low back pain, along with coming to see the chiropractor, I say, hey, you need to start a little yoga. Go home, get on YouTube, punch in there, yoga for low back pain. And there's one I know for sure that's 10 minutes long. And so I would start with that, some yoga, some stretching, instructional yoga, instructional stretching that you can get off YouTube and things like that. It's just about getting the body moving. And then as we advance a little bit, yes, there's certain things. I'm big on pillows. I'm big on supporting the head and the neck while you're sleeping and things like that. And so after about the third or fourth visit for new patients as of lately, I'm just sending them a pillow, a good cervical pillow to support the neck and the head and whatnot, because the rest of the body will follow the neck and the head, as we all know that saying goes. And so there are a few gadgets out there. I don't recommend them until they're absolutely needed and we got to spend a little money. But as far as just getting out there and getting busy, even walking will help your condition. Just getting up out of the bed and reaching down to touch the toes, to stretch the hamstrings, which attaches to the hips, which can put pressure on the low back. If we change our lifestyle, diet, nutrition, and get moving a little bit with exercise, a lot of these gadgets that are being advertised wouldn't be needed. And America is always looking for a quick fix, which is why these gadgets are very popular. And so I would say start with the basics, and then we move into different, types of things, Sean, as we move on.
Okay.
Good question. Excellent question. All right, go ahead and jump in with your question.
Pastor, can you hear me?
Yes.
Okay, I'm at work, but I got a question. I got to ask something. Dr. Matthews, I noticed I'm 44, and I noticed when I'm walking, my lower back is hurting. And I don't know what's causing that. It's almost next to my waistline.
Mhm.
And I have to stop in between
Mhm.
to start walking because it hurts so bad.
Mhm. Okay. Well, how long you been dealing with that?
I haven't kept, I haven't kept a record of it, but I just noticed lately, maybe last year, that's
Okay,
been
so
bothering.
at least a year.
Yeah,
Okay, has it gotten progressively worse?
it hurts. I mean, after I start and I keep going, it'll eventually stop, but I don't know why it's doing it. Sometimes I do fall asleep on the sofa, which I know that's not good.
Mhm.
Um,
Yeah,
I
sofa sleeping is not good.
I don't always sleep in my bed. I'm just gonna be honest.
Right.
Yeah.
Well, and you didn't have a traumatic incident, no slip or fall, no car accident, nothing like that, right?
No, I got hit years ago from the back, but didn't
Mhm.
go to the emergency room or anything like that. And that was years ago.
Yeah, and what we have to understand also, ladies and gentlemen, is that when we get into these car accidents, especially here in Atlanta, it's not if, it's when. When you get into these car accidents, you need to be treated by the chiropractor, no matter how minimal you deem the accident. Whiplash injuries have been recorded when you've been rear-ended. They have been recorded, soft tissue injuries, as little as 4 to 5 miles an hour. And so with that, when you're getting hit, and in your scenario, ma'am, because I can almost attribute some of that low back pain to that accident, because that force goes through you, and again, it goes through the lower back. That's just how force moves through the body, through the head, neck, body, into the lower back, into the hips, the strongest parts of the body. And when you are not seeing a body mechanic on a regular basis, and we're moving and we're grooving and we're into our lives with our jobs and our hobbies and whatnot, moving parts wear down. And so if you're not being seen by someone, you could get a bulging disc. Is there any radiating pain going down the legs or anything?
Nothing down the leg, just the lower back by next to, almost close to my waistline. That's where I'm
Mhm.
hurting. And I was like, oh my gosh. And I had to stop yesterday and start back again when I was
Yeah, and
walking.
what will happen is that the body will compensate for that. The body will try to do its best to alleviate that issue and whatnot, but it's an underlying issue that's not going anywhere until you directly address that. And that sort of low back pain that has progressed over a year will continue to progress, because you're not going to change your lifestyle, so to speak, especially, your work lifestyle. You were creatures of habit. And so what will happen is that moving part will wear out. You could have a bulging disc at this point. that just is not sitting on the nerve complex yet. There's a number of issues. An x-ray would definitely help me out to see the position of the vertebrae. And then we will go right into soft tissue, treating that area, and then an adjustment that will probably help you out. The first adjustments that you get normally will relieve pain 15 to 20% of the time, and every adjustment builds on top of the last one. Okay, that's why it's important to be at your chiropractor's office when they tell you to. There's another myth that goes around: once you go to the chiropractor, you have to go forever. For me, yes, I get adjusted 1 to 2 times a week. Okay, and I will do that for the rest of my life, because of course I'm in the business and I understand the importance of getting adjusted. But if you're not getting adjusted, if you're moving through this life trying to survive and whatnot, you have to take that extra step and go see the body mechanic and get your oil change, get an adjustment.
Okay, do you accept the insurance or no? You
Yes,
do?
I accept all major medical insurance except Kaiser. If you have Kaiser, they're just difficult. I have cash plans. There's care credit. There's a number of ways that we could take care of you. And also too, chiropractic has to be 2 things, okay? It has to be cost effective and it has to be convenient. And so when you're looking for your chiropractor, excuse me, when you're looking for your chiropractor and you don't know where to find one, you start with your friends, because somebody has a chiropractor that they absolutely believe in, and that you can believe them the same way you say, hey man, my car's down, you know, a good mechanic. You know that is the way that you find a chiropractor, that you don't have to start shuffling through chiropractors, because just like there's bad McDonald's and bad Burger Kings and restaurants, you know, there are chiropractors that are subpar also. And I'm not here to talk about my colleagues, but we know that there's bad apples in every profession, and the sooner we can cut them out or avoid them, the better. So start with your friends that you know are health reactive, because more than likely they're keeping the best kept secret from you, and that's the chiropractor. And yes, I accept all major medical. I have cash plans here, and of course, all personal injury and slip and falls workers' compensation.
Okay, thank you.
Thank you for sharing, Shay. And most employment offer chiropractic insurance. The insurance plans, the benefits plans usually will.
Well, I work for the county, so it should be. I'm under Richmond County, so
Absolutely.
I'm pretty sure that covers. I just have to get with Dr. Matthews or make an appointment. I don't mind driving up there to go see him.
Yeah,
to
and
see
I'm open on
kinda what's
weekends.
going on.
I'm open on weekends too. Saturday, I'm in the Duluth clinic. Sunday, I am in the Buckhead clinic.
Oh, okay.
Thank you, Shay, for sharing.
Okay.
We got
All
a
right.
question in the chat box. What's the best exercise for bus drivers with lower back pains? People who drive buses.
Repeat that, Doc.
The best exercises for bus drivers who have lower back pains.
The best exercises for bus drivers who have low back pain. When you're driving on a bus, you're essentially in a sedentary work lifestyle position, just like you are at a computer. So I do get this a lot. And so what I would do when you can is I would get up and do the basic stretches that you would do when you were playing back in the day. And that's toe touches. That's crossing one leg over the other and trying to touch the toes again, and doing that bilaterally. And as we get older, we need to hold those stretch positions longer. A lot of people are only doing 15 seconds and whatnot. No, 35 to 45 seconds. You need to hold those positions as we get older. We're losing flexibility, we're losing mobility, we're losing muscle and whatnot. And so that is why it's important to spend more time in our stretches. And it's the same format that you use in yoga. That same 30 to 45 second hold on a position. It's there for a reason. And so I would start there with just basic stretches that she can step outside the bus and do. And that's, again, touching your toes, stretching those hamstrings. You wouldn't believe how much low back pain can be alleviated by having, stretched hamstrings.
And when you drive long distances too, like I do, he used to always get on me driving back and forth to Augusta.
Yeah.
He said, drive an hour, get out, stretch, do your stretches and then get back, finish your trip. So I know bus drivers do drive long hours. Okay.
Mhm.
Question. Yeah, if you want to, keep it kind of private, you can just put the question in the chat box. But go ahead and shout out your question if you got a question for the doc.
Hi, Dr. Matthews.
Hello there.
My name is Tanya. I was just asking, like the pillows. I can't sleep on a real soft pillow, so usually I'm sleeping on 3 pillows. What is a good pillow, that you can use to, cause some mornings when I get up, my neck hurting, back hurting, everything, because I know it's because of the pillow. I got a new mattress, so I know it's not the mattress. I changed mattress. Well, so what do you suggest for like a good pillow?
Okay, I have her going to get one of the pillows that I send to patients so I can put it up in front of the screen. Now, before, what I would do, because I don't sleep on regular pillows. I prefer sofa pillows because they're much more firm and they hold my head up. And then I also use, okay, this is Tricor. All right, this is the cervical pillow that I use. All right, this is the cervical pillow that I send to my patients. This is the cervical pillow that I feel like gives the best results. Okay.
And where can you find those at?
You can find these online. Personally, I just send them through, I find them on Amazon. They're pretty cheap, 38, 40 bucks. And I just send them to the patients. Most healthcare plans will pay for them. And I automatically just send them. If you're here for 3 or 4 visits, you're going to get a pillow.
Okay. Thank you.
Mm-hmm.
Excellent question. Excellent question. Okay. Shout out your question.
Got time for another one? This is Joanne.
Yes,
On the
Joanne,
phone.
go right ahead. Go right ahead.
Hey, I was every 4 or 5 weeks going to my chiropractor, and then the COVID hit, and I didn't go. And all last year, I just stopped. Around November, my neck started hurting. Start getting this thing anyway. My primary care physician, he says it was a pinched nerve. Sent me to PT, physical therapy, and everything you just said. That's what I'm doing. I got the cervical roll pillow. I'm doing the stretches. Oh my goodness! So all I needed to do was just go back to my chiropractor.
Yeah, for the most part, because all of those things are supplemental. The pillow is supplemental. All the TENS units, the therapies that we do, all of that is supplemental. The issue is the chiropractic. That is what you need to get on a regular basis to get you back on track. And then once you get back on track, then that is when the chiropractor should put you on a regular schedule once every 3 weeks to maintain the progress made. Yeah.
I'll go back. It was just, I stopped because of the pandemic. I mean, I stopped almost
everything stopped.
and,
You weren't.
But I had no idea. I didn't know that would happen. That had never happened because I've been on the regular schedule.
Uh-huh.
But I thought it was something else.
You can get addicted to chiropractic because you can get addicted to feeling better. I mean, that's just bottom line. You'll feel better.
It is, yes.
So I have a question too.
Yes.
Go ahead.
If you've had back surgery and, constantly you have back pain, like it flares up or whatever, is it best to put ice packs on it or heat? Which one will work?
Well, it depends on what kind of surgery, because if you have screws in your back and you put heat on there, heat and metal makes it expand. So that could increase the pain. I would go with the ice because ice preserves. Like you get a whole bunch of fish, you're not gonna eat all that fish. So what you're not gonna eat, put in the bag and you freeze it to preserve it. And so if you're going through low back pain after surgery, one, you need to still see the chiropractor. You say, well, I don't want him snapping a crack. No chiropractor worth his degree is going to snap a crack someone who has had major surgery. There are very low force adjustments that we would apply above the surgery site and below the surgery site that could help with your low back pain. But once you go into surgery and once they cut, there is no turning back. Okay, now we have to maintain what man has not touched, and that's above and below that area of surgery. So I would go with the ice more so than the heat. Ice at night, and then maybe some heat in the morning because you're getting ready to go throughout your day and get out and about, and things need to warm up, kind of like you warm up a car in the winter. Okay, kind of that concept. But at home, you're home for the night. Don't put heat on there. Because you're going to bed, you're going to calm down. Put ice on there so it can take the swelling away, take inflammation away, and allow you, and also pain. It's a good pain reliever, and it's natural, and therefore you can deal with your low back pain better at night using cold.
Thank you so much. Thank you.
Yes, ma'am.
Awesome. Excellent question in the chat box, Doc. With the increase in use of cellular devices, iPads, etc., especially in youth, how do you think the constant looking down into your phone will affect their spinal health in the future?
Okay. Back in the day, I'm 48 years old. Back in the day when Shaq was in his prime, Shaquille O'Neal, the basketball player, there was a running joke. He did a Taco Bell commercial, and people were suffering from what they call taco neck. Okay. And so that's the same thing, text neck. And so people constantly looking down. Right now you could tell yourself, I'm constantly looking down at my phone. If you really reflect on how many times or how much time you spend looking down on the phone. And so if you're in that position, you keep going in that position, moving parts wear down. So yes, you're going to have some side effects from that repetitive stress injury. Just like staying on the computer for 5 to 7 hours, that's a repetitive stress injury. Staying on your phone for 5 to 7 hours or all day, consistently looking down, texting on your iPad. Modern technology it's a wonderful thing, but it has created such bad ergonomics for the human body that it has opened up a whole new era of injuries that we didn't see 10 to 15 years ago. So this modern technology is a gift, and it's also a curse.
Excellent question. Another excellent question in the chat box. Do all chiropractors offer massage services, or does that depend on the chiropractor?
Yeah, it depends on the office. There are some that 80% of chiropractic offices do offer massage. I offer massage at the Buckhead Clinic on Tuesdays, Thursdays, and Sundays. I have yet to find a worthy massage therapist for our Duluth office. So yes, I offer massage. Most chiropractic offices offer massage.
Excellent questions. Go ahead and shout out. Yes, go ahead.
This is Cheryl. I have a quick question. Hi, Dr. Matthews.
Hello
I
there.
sit at my desk quite a number of hours a day, maybe 6, 7 to 8. And I started having neck, back pains. And so I did go to a chiropractor and I started getting some adjustments, but it still didn't go away. And so then we had the occupational people come to do the ergonomic assessment. And so I got my chair and my, height and all that aligned. And I actually converted to one of those stand-up type.
Yes, a stand-up workstation.
Yeah, workstations as well. But so I stopped going to the chiropractor. I got my chair and all that situated. And so I'm not having the pain anymore, but I'm finding myself slipping away from using the stand-up desk station. So what's your advice on the use of that, and maybe how many hours I should alternate going from sitting down to standing up?
Okay, I have a standing workstation in my office that I prefer standing versus sitting. However, I would alternate. You can do an hour sitting, an hour standing. Depends on how you're feeling that day. I definitely would alternate though throughout the day so that I could give my body a chance to move around and things can fall into place and whatnot. because the body will compensate if you're going to stay in a certain position for prolonged periods of time. Your body has to stabilize, your eyes have to see and accommodate. There's 100 things that go on when you are in one position and working diligently for hours upon end. Getting your workstation correct, ergonomically correct, that is one of the biggest things that you can do if you are working from home and you are working in the office, is to go ahead. Most companies will either contribute or buy you a ergonomically correct desk or chair or standing workstation.
Yeah.
You just need to go to your HR and ask if they have a wellness program or a program that will purchase equipment, ergonomically correct equipment for the house. Working on the bed on your laptop, working on the dining room table, sitting on the sofa, you're just setting yourself up, and you need to find a better workstation if you're working at the house. I would definitely go back to the chiropractor, even if it's on once every 3-week basis, because you need that in conjunction with your correct ergonomics, and you will see better results. And also, there might need to be a tailor-made program, physical exercise program to fit your lifestyle, to also help contribute into you getting better.
Okay, thank you.
Yes, ma'am.
Excellent question. I had my ophthalmologist share something with me recently that I had never heard. And she said, make sure that your monitor is aligned with your monitor, and your head are aligned. She said, even your pupils, if your screen is up and you're looking up or you're looking down, that affects the eyes. She said, make sure you're right at the top, your monitor is right at the top of your head. So
yeah, and you can, and I'm glad you said that, Doc. That is one of the first things I do tell people who have who are suffering from the chaos. I ask about their workstation and their setup, and they do. Sometimes I even ask for pictures so that I can see what's going on. And yes, one of the first things I tell them to do is, hey, raise that monitor up so that you are just looking straight ahead at that monitor. I know most people don't have a yardstick, but you can take a broomstick and you can see, if you put it at the top of your head and on top of the monitor, you can actually see that line, or have somebody look and see, hey, is the broomstick, yardstick going up, down, or is it even? And if you take some time to rearrange your desk, like, you should never be reaching over for anything at the desk. You should never be reaching over. Everything should be right at arm's reach, right at arm's reach. The mouse should be at arm's reach. The mouse should be supported. Your arm should be supported on the desk and not hanging off with the mouse. You should have a protective pad underneath your wrists as you're typing there, to keep the wrists elevated, and so that carpal tunnel doesn't develop and things of that nature. And chiropractic can help with carpal tunnel. We move the little bones in between the wrists and the hands that opens up that tunnel so that it can get you relief. And you don't have to get that surgery. You don't have to get those injections. You can always go get those once you've done everything. All alternative methods have been exhausted. You can always go get shots and surgery.
Awesome. Questions? We can't hold Doc too long, but we asked while we got him here.
Yeah, no problem. Doc, I think you were asking about children.
Yeah.
What was that question?
Yeah, you offer pediatric and pregnancy chiropractic. How early should we introduce our children to chiropractic services?
I adjust infants. I've had mothers, and as far as pregnancy, as soon as you find out you're pregnant, you need to go to the chiropractor, because during the course of your pregnancy, as everything's expanding and you're gaining weight and things are going haywire, there's not much the MDs can do. They can't give you no pills. They can't give you no injections. And so the only natural thing to do, and you can Google this, pregnancy and chiropractic. Chiropractic is very good for pregnancy. I've had mothers who have come see me before they got pregnant, get pregnant, and come see me throughout the whole 9 months. And as soon as they feel confident to bring baby outside, they bring their baby to me. So, you know, and if you need testimonies on that, you know, I can, you know, give you a number of patients who have seen me throughout, you know, their pregnancies and whatnot. If you have a spine, you are eligible for chiropractic, plain and simple.
Thank you.
Now, mind you, also, let me put this out there first. I don't snap and crack no babies or anything like that. I have a small little instrument that I use that gets, and it has low force, and I do an example on the mother's hand and everything like that so that she understands that, you know, I'm not gonna, you know, do nothing drastic here to make her have a heart attack to her baby. So we take very good care of the infant or at any stage of child. And also the pregnant mother and whatnot. We offer pregnancy massage that go hand in hand with the chiropractic care. Mhm.
And massage therapy is an awesome preventative medicine as well.
Yeah, it works right with chiropractic care.
Absolutely. It's so good to see all more of the men on the call tonight. And Rick, thank you for sending out that shout to get the brothers in. You talked earlier about prostate cancer and colon cancer being it's just out of control when it comes to Black men. Of course, women are being impacted by that as well.
Yeah.
But what age should a man or woman begin thinking about having these exams? What's the earliest age?
For Black males, when it comes to prostate cancer, that's right at 35 and up. You know, I get my digital exam, you know, every year. You know, PSA every year, because I need to know. I'm not leaving this earth until God says you got to come on home. And so I'm doing all the preventative things that I can. And as far as, and then you have to look at your family history. Okay. Also with colon cancer, ages 35, you know, for African Americans, for Black people, we have got to start early, simply because of how we grew up for generations. You know, that gets passed along, and then those genetic dispositions, they show their ugly heads, especially if we aren't taking the right in-between measures, good diet, good nutrition, good exercise on a regular basis as a lifestyle. These things creep up on us more so than them. And we have got to be proactive, and especially for Black men. Black women, they go to the doctor. 95% of my practice is female. And because that 5% of males, they are concerned and they are a different breed. However, that needs to change. We cannot, as Black men, just go until we can't go no more, and then go to the doctor and find out that we are far along in the stages of prostate or colon cancer, or the low back issue is past the scope of chiropractic. You know, it took you years to get into a condition. You know, chiropractic is not a quick fix. It's a natural way of care. So naturally it takes a little longer, but it's natural and it works. And as long as you're proactive, you know, all of these things can in the healthcare industry can work to your advantage.
So you recommend so you saying the PSA, that's a blood test, right? Is that a blood test? And then
yes,
then
PSA.
You do both every.
Excuse me here. Hold on. Let me get right to it. Where is it? Oh, here it is right here. A PSA test measures the level of prostate specific antigen in the blood. Okay, so not only do you have the digital or the finger exam, you have the PSA test. You correlate those two together, and that's where you start to come up with your game plan. And that way, if your PSA is normal, if your digital exam is normal, then they put you on, again, what we call the active surveillance. Now, for Black men, that's a very sensitive thing to do because of how prevalent prostate and how fast it moves and kills us and whatnot. So you have to be in great alignment with your medical doctor when it comes to the prostate, when it comes to the colon. Stay on them. Take people with you to these appointments that you don't mind hearing your health information, so that you have 2 sets of ears, 2 sets of eyes, and then you might have 2 different questions that can be answered, and then you can come to a common ground on things. But you know, your healthcare is definitely a community family thing, and everybody needs to be involved in that.
Excellent question. Another good question in the chat. Can a osteopathic doctor do the same thing as a chiropractor?
Great question. An osteopathic doctor, they can adjust. However, the adjustment classes that they take are electives in school. Okay, so they elect, like an elective you pick in high school, like home ec, you pick home ec as your elective. Well, they pick adjusting sometimes as an elective. It is not a part of their curriculum. We are the experts when it comes to adjusting the spine. And that's just plain and simple. And I'll go up against anybody on that.
Excellent question. Okay, I'm gonna ask my last question, and then we'll take one or two more from the family if you have it. Headaches and sinus pain management. I know you specialize in that as well, Doc. Since we're heading into the pollen season,
Yeah.
what advice can you give persons who suffer with that?
When we talk about headaches and sinus, we talk about the upper cervical, C1 and C2 in the occiput, or the head and the very first two bones in your spine. Those are the most movable. Those allow you to move left and right, look, you know, snap your neck, everything like that. And so when you have headaches, we want to make sure that those nerves that are immediately coming off of the brain stem aren't compressed or caught up in the upper cervicals. And so we pay attention, we take specialized x-rays, we take lines of measurement to the bones in the spine in comparison to the one above and below. And we find out if those angles are off, and then we adjust our adjustments according to those angles and measurements. And that is how we get very good results when it comes to headaches and sinuses.
Excellent, excellent. Okay, we'll take one or two more questions. Ask the doc while we got him on the line, man. This has been fantastic.
And while there's a pause, remember my contact info, my email is getwell, GETWELL at RCCHIROPICenters.com. RCCHIROPICenters.com. My phone number for both clinics is 844-722-4470. And I have a clinic in Duluth and in Buckhead.
Excellent.
Can you repeat the email or the website? I'll type it into the chat so we'll have it.
Getwell, GETWELL at RCCHIRO, RCCHIROPICenters.com.
Excellent, excellent. And we'll get some of his cards too, and we'll bring them to the ministry.
Okay.
Anybody got a burning question before we adjourn?
I do.
Yes, go ahead, Pam.
You talked about you was telling Tanya about the pillows to support your head and all.
Yes, ma'am.
What about like with me, I have a handicap in my right leg and I have issues with my left knee, and I can only sleep on my back, and that hurts sleeping on my back. And with COVID, I had to stop going to my chiropractor as well. And so what would you suggest with that as far as pillows up under your knees, trying to support your back? Because if I lay flat because I'm on my back, it hurts my lower back in the morning. I have trouble getting up.
Okay. What about sleeping on your side? Here's what I tell people with that. There are things called a body pillow. Okay, a very long pillow just like that. And so if you're sleeping in the fetal position, if you start in the fetal position, that body pillow is long enough where it can support your neck and your head. And also the fetal position is the natural position that the body wants to sleep in. Now, where you end up in the morning is just where you end up in the morning. We can't control that. But if I were you, I would start with the body pillow, and you can go get a body pillow at Walmart. You don't need no newfangled expensive body pillow. Just get one that's firm to you. And then it doesn't take 2 weeks to get a good night rest. It takes maybe 1 night, 2 nights, and you will be able to tell. And that goes with mattresses also. Patients come in all the time and say, hey, doc, my bed's old. What kind of bed do you recommend? I sleep on a Costco special. Okay. I wouldn't spend over $1,000 for a bed. Anything after $1,000 is just bells and whistles. And it does not take 2 weeks to get a good night rest. So the first thing I would do is find out the refund policy on the beds and mattresses and the pillows, make sure that those are feasible, try them out. And if they're good, good. If they're not, send them back and keep experimenting until we find the right one.
Thank you.
Yes, ma'am.
Excellent. Man, this is good. This is good, Doc. This exceeded my expectation, man. We had more on the call tonight. I really appreciate it. Excellent questions. We're going to be following up. Of course, our theme God gave us this year was ministering to the total person, spirit, mind, and body. And it all works together. God's word says, I wish above all things that you prosper and be in good health, even as your soul prosper. God is extremely concerned about our physical health, family. And one thing COVID showed us in 2020 that we just got to do better. I mean, we have got to do better. And I think as a community, we're doing better, but knowledge is power. Knowledge is power. So, can we just praise God for Dr. Matthews coming on tonight and just, man, he dropped so much knowledge.
Thank you very much. I appreciate
So much
it.
knowledge.
I appreciate it.
Yeah, this has
Thank
been a
you.
blessing. This has been a
Thank you.
blessing.
Yeah, and feel
Doc,
free to
we'll
email
have-
me questions. Feel free to call. Give me a couple days if you email. I'll try to call you back as soon as possible. But yeah, don't hesitate on the questions. If you have issues, I can help you out.
Thank you.
Amen. Go ahead and give me one of them pillows. My mom, she won't send her one of them pillows right away. So
Yeah, I got you.
we'll work that out. Family, thank you so much. This has been great, man. God is blessing us. Just want to close out with prayer. Father, we just thank you. We're just grateful. We're just grateful for this, the blessing of COVID-19 that prompted us to be innovative and start our WZW. And you told us that this was going to be very effective, very powerful, very informational. This time of sharing would bless us spiritually, mentally, emotionally, physically, and relationally, God. And you're true to your word. We thank you for Dr. Matthews. I know his practice is going to be even blessed, even more. He is a man of God who trusts you, and we are praying for him in the loss of his parents last year. We just thank you that you're keeping him strong and healthy in mind and spirit and body, and even blessing him even the more. God, continue to bless us all and continue to use us for your glory, and we'll be a blessing to you people. We love you. In Jesus' name, amen.
Amen. Good night, everyone.
Good night,
Good
everybody.
night. Thank you,
Good night.
family. God bless y'all.
All right. Y'all be good. Y'all be
Good
careful.
night, everybody.
Great
Stay
job, Doc.